We do things so backwards in mainstream medicine. We don't handle the problem starting, at the top. Like, for instance, you've probably seen some cases where you've seen people turn around and been able to get off some of their medications being in the space that you're in. Do you have a story? Do you have somebody that you know that's actually, there's been some things been able to change because they're doing oral supplements and peptides?
Yeah, for sure. I mean, there's plenty of stories, right? And I think in this space too, unfortunately, I think with a lot of gut health patients, our current healthcare system totally fails those patients, right? Because it's either steroid or some kind of biologic. And so a lot of patients looking for different options come to functional medicine providers, a lot of providers in the space. So, patients that starting either lorazepam or the gut tides, things like that, have been able to get off, certain medications that were causing them a lot of side effects, and it totally changed their lives, right? Of course, lifestyle modifications, things like that, diet changes are also super important. But yeah, definitely, I mean, there's plenty of stories of patients getting off their, cholesterol medications, or even, losing a bunch of weight, getting off blood pressure medications as well. So it's definitely, a common theme, in this space for sure.
Well, a lot of things that you guys offer, actually, I really feel like they support people in the GLP-1 space and GIP space, so the trizepatide and the semaglutide space, because there's missing links there. And there are people that are resistant to these agonists or medications that help their insulin regain sensitivity and remove the resistance, but it doesn't address other things. You guys have some options for that, like oxytocin recommendation, right?
For sure, and that's what the biggest thing, right? These GLP-1s and GIP-1s work. If they're not working in patients, there's usually some other underlying condition or reason why they're not, right? Some inflammatory status, whether it be from stress and cortisol, like you're talking about oxytocin, whether it just be, unfortunately, obese patients and adipose tissue is pro-inflammatory. So it's like a perpetuating cycle of inflammation, which causes insulin resistance. And then, or gut health, right? Your gut is like 70% of your immune system. You have antigen trafficking, highly inflammatory particles being released. If they have leaky gut, that's causing insulin resistance and causing metabolic issues. So we do have a bunch of things that, that patients can use to kind of help negate that inflammatory status and help, like you said, with insulin resistance and regaining that insulin sensitivity for sure.